October is Breast Cancer Awareness Month. I'm sure you've heard. And of course, prevention and awareness still crucial even during a pandemic. Dr. Kayla Barnard, breast surgical oncologist at Menorah Medical Center, is joining us this afternoon. Dr. Barnard, thank you for joining us today.
Thank you for having me, Carolyn.
So what worries you most? As a breast surgical oncologist in a pandemic, what has you most concerned right now?
My number one concern right now for women as far as breast health goes in the pandemic is not getting their screening mammogram or not getting help or seeing a physician if they have concerns about their breasts.
Because plain and simple, breast cancer not taking a break due to COVID.
That's absolutely right. It's not going to take a break at any time, and it doesn't care whether we are afraid of COVID or not. So it's very important for women to understand that they need to get their breast mammogram and they need to do their breast self-exams, because the earlier we detect breast cancer, the better survival outcomes we have.
But what do you say to friends of mine who have literally said, I'll just wait until all this kind of mess passes? It can't be bad to wait, 6 months or so? What do you say to them?
Yes, that is true. But sometimes 6 months turns into a year turns into a year and a half. It's not good to wait. Just put yourself first. Women wear a lot of hats. They often put themselves secondary to their partners or their kids or job. And Breast Cancer Awareness Month needs to be a time where they need to remember, hey, let's just take a step back and put ourselves first, because again, the earlier you detect it, the better outcomes you have. And some women already have things going on within their breasts, so it's not that they need to put things off any longer.
And I think it's interesting. I know you have said, other experts with HCA Health have said, if you are, God forbid, diagnosed with breast cancer, don't settle. What do you mean by that, not to settle?
Don't settle for the first person that you see or the first recommendation that you get. It's always good to get a second opinion. And you want to have a team after you are diagnosed with breast cancer that is going to provide you with all of the facets of breast care and cancer treatment around that. That includes the surgeon, the medical oncologist, the radiation oncologist, having genetics available, not just testing, but genetic counseling, that's very important, and having a nurse navigator to help you and guide you through this process.
Dr. Barnard, wise advice, October and throughout the entire year. Thanks again for joining us today.
Absolutely, Carolyn. Thanks for having me.
For more from HCA Midwest Health, go to kctv5.com/HCA Midwest.